So continuing with all of our dental hygiene tips, it's all about the handoff. Patient's been finished, and we want to get the doctor inside here. So now we want to introduce the doctor to the patient, especially if they're a new patient. Typically that's done at the beginning of the appointment, especially if it's a new patient, because a lot of states require a dentist to have that interaction with the patient before he allows the hygienist to work. But let's just assume it's a recare appointment. Reappointing, reintroducing the patient, there's nothing wrong with it. You guys have got thousands of patients. There's nothing wrong with saying, hey, Dr. Jones, remember Mrs. Smith? Remember she's the one with the 3 children and blah, 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 blah. That's exactly what you need to do. There's no shame in making little notes in the patient chart about who this patient is, so that before the doctor gets in the room, you've already made kind of a reintroduction to the whole thing. Have all the notes of everything that you found that you want the doctor to review on there. Have all the photographs and everything printed out ahead of time. Make the interaction between the dentist and the patient nice and easy, so that you've kind of pre-educated everybody as to what the next steps are. That's a really, really important part. So here's the problem with all of that stuff. What if the doctor is busy? What do you do then? Well, what you really want to do then is you want to have a communication throughout the hygiene appointment with the dental assistant, so that the doctor sometimes will break away from whatever they're doing and get into the hygiene room before the end of the appointment, and that's okay. Because a lot of the screening is done at the beginning of the appointment, and if all you're doing when the doctor interrupts you is doing the scaling and root planing or the adult prophy or whatever is going on, the doctor can sit down and have a conversation with the patient and let you resume what you were doing, so that he can go back or she can go back to the patient that they were treating. So what does this mean again? The dental hygiene appointment, there's a lot of screening in the beginning, then there's the actual, cleaning and maintaining of the teeth, and then you want the doctor to come in at the end. Sometimes the doctor needs to come in the middle. How do you know when that's going to happen? You're going to talk to the dental assistant at the morning huddle. You two are going to interact about what's the best time for a doctor to come in to do a hygiene check. And guess what happens at the end of the day if it didn't really work out as best as it's supposed to? You have the afternoon debriefing. You're going to go to the dental assistant. You said for me to be in there at 9:30. I was there at 9:30. You guys were in the middle of some place where you couldn't stop. The patient had to wait longer. That was a little bit hiccup. That's why you do the debriefings. You want to find out what went wrong and went right during the day. So figure all that stuff out at the morning huddle, debrief at the end of the day, but the doctor should be able to step in pretty much anytime he or she wants to keep the day flowing.